I'm Dr. John Perryman. I'm a pediatrician with Mercyhealth in Roscoe, Illinois. During the COVID-19 pandemic, we've seen in many situations, both in our practice and in other places too, where parents, for whatever reasons, have been delaying well-child visits. We want to encourage people not to do that for a number of reasons. I understand the concern people have with going to different places, going to public places, going to doctor's offices, but in delaying these visits, there are a number of risks that you take. One is that we cannot monitor a child's growth and development like we normally like to do. Another one is that immunizations are delayed. And there's a number of very critical immunizations that are given, especially in the first 2 years, but even during the school age years, where a delay can cause a child to be at higher risk of contracting an illness and also spreading it within the community. So we encourage all of our families to make sure they're getting in for well-child visits at the scheduled time. So the CDC has sent out a report, or published a report back in March, and what it showed was that the amount of vaccine being ordered by pediatrics practices was dropping for measles vaccines and other vaccines as well. And what that indicates is that there's less vaccine being administered in offices. So why is that important? Well, what happens is that with any vaccine preventable illness, when the amount of immunity in the community drops below a certain level, there's more of a risk of the disease coming back. These diseases that we vaccinate against are not eradicated, they are still around. And we've seen outbreaks in different places in California and other places where measles pop back up again. Whooping cough we still have in the community. It's not nearly as prevalent as it was before vaccine, but we still see it. Polio is still present in certain parts of the world. And what happens is that if you don't keep a community vaccinated while the disease is still present, it will come back. And that's why it's so important to keep up with these routine vaccinations. Mercy has implemented many different protocols and steps to help keep patients safe when they come in, because the last thing we want to do is make the visit to the doctor's office a risky visit for you. So we've changed a number of things. We've changed the layout in the waiting room so that there's social distancing. We have changed the way we clean the rooms in between patients in order to make extra sure that those rooms are clean and disinfected. We have changed the ways in some of the practices in terms of how we schedule patients, so we don't have as many people in the waiting room. So there's a number of things that we've implemented to try and make sure that the visit here is as safe as can be. We all wear masks throughout the whole day, and everyone who comes into the building is required to have a mask on. We also try to limit the number of people who come in with patients to try and limit exposures. So those are some of the steps we've taken to try and make sure the visit is as safe as it can be for the patient and their family.